After all, if we're not healthy, all this can go down the road. And we're going to be working in partnership with the two organizations I'm going to introduce you to organize a health forum. And on your magazine, there's a page dedicated to our strategy partners in terms of the health component. And the African Health Forum program. And we're going to announce that forum. It's going to be sometimes in September. I'll let the organizers introduce it. So US Africa Diaspora Business Forum, besides the business component, is going to work with others. It's going to make its infrastructure, its media, its community and social capital to lend it to other entities who also organize the other aspect of our lives. So there will be the announcement. I'll introduce the organizers. But before I go there, where is Deborah? Another aspect of our strategic partnership is to work with people in different professions. And Deborah is a very strong part of our community. She's supported this forum. Her program is also introduced in the book. If you can stand up, Deborah, and please give her a warm. Yeah. She's the one who went to the market and bought the lunch that you ate. And hers is coaching on two levels, personal coaching. Earlier we were talking about entrepreneurship. Before you venture out, you really need to ask serious questions. You really need time and space to look, take time, and don't be quick to make a decision. You need to evaluate self. You need to look a whole lot. You have to take yourself through a process. And it's a midwifing of the soul within you that has been buried by many noises before you wanted to be a social entrepreneur. So that coaching is very important. Also, group and the team you assemble needs to go through a space where they come together. Before we venture out, we have to build that trust. So her entity and her organization is joining us to help us in that capacity. And for more information, you can talk to her in the networking session, and you can also read up about her in our magazine. Okay, with that said, I'm going to introduce, we're going to announce the whole forum. We also have a special treat for you. Another person have taken his time, paid money to travel all the way. Dr. Ferguson, he's with us. He would share his program. He will give us a presentation. He's part of the health equation. So give me a warm hand to welcome Ray Bridgewater and Minnie Abbey Ford to introduce their respective organization and their joint project called the Health Forum. Thank you. Yeah. You want to do it then? Whatever. Okay. Yeah. So briefly introduce your organization and tell us what you're cooking for the Health Forum. And then we'll give Dr. Ferguson.
Okay. Good afternoon. Can you hear me? My name is Mirabi Ford. I'm the Executive Director of the Mignon Innes Ford Foundation. We work with cultural bridge building among African diaspora. I really want to thank the Baboon family for giving us this opportunity. It's really a great chance for us to express our gratitude and share our shared vision and value. Briefly, my foundation is dedicated to my grandmother, Mignon Innes Ford, who was a Barbadian person who came to Harlem and decided to go back to Africa to live and develop her home country. She chose to be Ethiopia along with her husband. Their mission in going to Africa was to make education a universal reality, and also specifically to make sure that women have equal opportunity in the educational field. They believe that education has to be accessed both for men and women equally, because nation building requires both. Their curriculum was Afrocentric. As Dababu said earlier at his first introduction, when we speak about cultural bridge building, we're talking about the diaspora, the human diaspora, and the African diaspora. In the case of the African diaspora, there's a special need to make sure that we know about each other, whichever continent we may be. Part of our mission in the foundation is we find that many African immigrants coming here to the United States are ill-informed about the historical contribution of people of African ancestry. In addition, there's a lot of more negative information than positive information. This leads us to clamp up and not communicate and really get to know our cousins who preceded us, who sacrificed a great deal for us to come and build upon. Again, I refer to what the Babu said, we are truly African American as well. But most importantly, we are part of the African diaspora, the human diaspora. When we were working with Ray, and Dr. Ferguson as well, he would also let you know, we were thinking when we did the discussion about the business forum, we were focusing on health. Like my grandmother used to say, if you have your health, you have everything. So it kind of makes sense now that you heard all the good stuff about doing business and doing good work. You have to have your body and your spirit right, and that's your health. Ray, as he will also tell you about his foundation and health work, we believe that there's two components. There's the betterment of the African diaspora health and also the health enterprise component. We all know we send money home for somebody to get something. It's not just food. It's to take care of health issues. In addition, we also know that African communities here are accessing health care, but the healthcare system is not acculturated to us, I should say. But we also are in the process of getting to work our way. Our foundation really is introducing African immigrants to letting them know, welcome, yes, you have a right. You also have a responsibility to represent yourself and demand services that meet your standard, your health needs. Ray will talk about his company, which is multicultural approach to keep providing this health care. We are really, really excited in putting together a health forum with the idea of inform, mobilize, and connect. We look at this as a very, very critical area that is not given adequate attention. And as much as we talked about the different kind of businesses, the healthcare industry also is critical. Dr. Ferguson would also talk about how these disconnected systems are not working, and he will present his approach. We also want to look at what is it, the same way we want to invest in business back home and vice versa, we want to do a health component to add to that. So I'm very excited, and I don't want to take too long. I probably forgot a lot of stuff, but you can always ask me questions. As I said, we are very excited. We are working and putting together a similar forum specifically looking at the health component, and I will yield to Ray so he can talk about it, and then after Dr. Ferguson, we can take questions, and he will also have a special presentation for you. Thank you very much.
Good evening. My name is Ray Michael Bridgewater. I'm the president and CEO of the Assembly of Petworth. The Assembly of Petworth is a community empowerment organization that was originally funded from the Kellogg Foundation. It was established to build partnerships to become a cultural broker, and that's a very key word. A cultural broker is a person who go across their culture and go across racial lines, going into other cultures and bringing them together to do projects. So we're a multicultural organization because we have crossed many paths to make this a organization that reach out to a global population, an international population. So our partners are from the Latin American and Hispanic communities, from the Asian community, as well as the African Caribbean community, because we feel that that is necessary to do. We're kind of like the beginning of the Kellogg Foundation investment in looking at the African American population. And in the past, they had funded programs like the Fatherhood Initiative, repairing the breach. If you, some of you remember back in the 90s when there was an organization that was created to deal with African American and African American young men and women, and repairing that breach between the family, in particular the father and his family. And as you know now, well, President Obama has picked up on that piece by putting a program out there, really trying to reach out to the African American men and the Latino Hispanic men and their family. Our health component, we deal with health and technology, workforce development, and building public-private partnerships to look at how to best to bring health initiatives to communities. We use a media campaign, but in particular, medical mobile units. Those of you who know about me, most of the large medical mobile unit projects in this region, we probably have some parts in that aspect. One of the areas that we're going to be concentrating on today is oral health. As you may be aware, there's two areas in this country that is not really covered by primary care. That's oral health and mental health. So these two areas are the last frontier when it comes to health initiatives. I'm going to read you just one little data piece before I turn you over to Dr. Ferguson. The American Cancer Society do a global fact and figure data. And you'll find a very interesting data piece in here. All of Africa is 1 through 5. East Africa is number 1. Middle Africa is number 2. Northern Africa is number 3. Southern Africa is number 4. Western Africa is number 5. The Caribbean is number 6. Central America is number 7. South America is number 8. And North America is number 9. We're talking about cancer. Okay, but you can equate that with diabetes. You can equate that with heart disease. You can equate that with many other diseases. A lot of people think Africa, the United States, but actually there's that circle that goes through South America, Central America, and winds up in the United States. So we're talking, when we talk about that, a lot of people are not aware of that path. So that's the reason why we reach out in a multicultural manner and reach out to our brothers and sisters from the Caribbean, our brothers and sisters in Latin American countries, because really this is a global issue, and oral health is a global issue, a major global issue, because everybody is affected by that. So with that, I'm going to turn the floor over to Dr. Fred Ferguson, who's going to introduce you to a project that is now being implemented in a tri-state manner. And when we talk about global health, we also talk about tri-state. Most of our projects are multilingual. Most of our projects have medical mobile units attached to it. Most of our projects have a public-private partnership structure where it involves the smallest of groups like grassroots organizations and connect to the larger groups like hospitals and universities. So this initiative is now going on in a tri-state manner. We have a tri-state partnership, Northern Virginia, Washington, D.C., and Maryland. And that's the proper way to do this when you're doing, it's never central to one area. It's a global. And when you look at it from the aspect, you're looking at a tri-state aspect, because you must reach out to a population that crosses a lot of lines to get health. with that, I'm going to turn the floor over to Dr. Fred Ferguson, and he will talk to you about an initiative called My Smile Guide You.
Hi, I'm Fred Ferguson, born and raised in Washington, D.C., Howard University, Maryland University, did my peds at UConn, and I'm now at Stony Brook. I've been there since 1975. I am the Division Director of Pediatric Dentistry for SUNY Stony Brook. Provider of patient care across all kinds of kids, most of whom you won't see walking around. I direct our pediatric residency program, develop community-based projects. So what you're looking at is a kind of, how can I say, my mantra is, why am I here? Why are we all here? It's very simple. I say to my students, why are you here? They give me all kinds of answers out of a book. I say, no, you're here to learn. That's it. You're here to learn. Every encounter is an opportunity to learn. If you're not learning, you're burning. So I'm going to, essentially, we've been walking like this. We've been walking like this when it comes to health. And I'm not trying to slow you down. I'm actually going to try to get you to turn around and walk the other way. The most difficult thing I do as a health provider is not the thing I was taught in dental school. No. The most difficult thing I do as a health provider is to change the behavior and the perception of my patients. And my patients are parents, and the kid is nothing but a symptom. Okay? So, as Ray said, there's a growing bit of evidence that points to this. And what I want to do today is to try to give you a little bit, kind of a real condensed version, and hopefully you'll get it. Okay, so this isn't working, so next. Okay, so how are we doing in healthcare? I'm not talking about all the fancy things we have in health, but how are we doing in our healthcare system? Are we doing good? You think we're doing good? Raise your hand. Please, raise it up. Come on. You think we're doing a good job? No, absolutely not. There are three primary groups. They're right here in front of you. Consumers, they're the payers, should be ER, and there's the health providers. I'm a health provider. I'm also a consumer. And we're doing a really lousy job. And the patient is very sick, patient's sick, and the primary symptom is cost. We're not talking about health, we're talking about cost. So how can you take something like health and make it into a commodity, like a new toaster or a laptop? Okay, how can you do that? Okay, it's just not working. And our present system is fatally flawed. It cannot work. It will continue to get worse. We will continue to see this divide. And there's some big issues here. These three groups, they're not pointing to themselves, they're all pointing to the other entity. That's the other problem. Next. Okay. Well, this is essentially my view of it. Our culture of reactive, you go to the doctor, doctor's going to make you well, fix you, okay? Care cannot address the concerns driving chronic health problems, its impact on overall health and well-being. And we hear these two words, these two issues, costs, and now people are getting uptight about health disparities, those who have not. The opportunity for me is that I can ask you a bunch of questions, and based upon the answers to my questions, I don't have to look at you. I can tell you exactly where you are, and I can tell you exactly where I think you're going. And that's really the basis of what we're talking about. Next. So, global health, here it is. Here we are. Doesn't surprise me. Pretty much everything about us is about the G and the NG, the genetics and the non-genetics, everything else. Okay? So, pretty much the chronic health problems that we're battling, predominantly non-genetics. You might have some genetics in there, varying amounts, but even if you do, it's the NG that's going to drive you. Diabetes, perfect example. Your doctor can tell you what to do all you want, give you all kinds of medications, but if you don't change your lifestyle, you're going to burn. You're going to burn. And that's what's happening to us. Next. So, back to my thing, backed up by the global health slide. Thank you. Go for it. Thank you. is that without question, this is by far, well, I know everybody here has been to the dentist for some care. Everybody. Maybe one or two of you haven't, but pretty much everybody has. And do you understand that whatever your dentist does for you ain't saving you? Because you're in a progressive journey of more complex dental care. So while you're pointing your finger at your dentist, you need to look in the mirror and understand that you are the one who's generating your chronic illness. And those same issues that are generating your chronic illness here have a lot to do with what's going on elsewhere. That's the connection. That's the connection. But go back, please. But here's the real kicker. The problem in our system is that the health information doesn't do anything. It's really just working between the payer and the provider. The consumer is off there just having a good time, not doing anything. Earlier, we had the panel just before us, the gentleman who was sitting over to the left there, the right, had a slide that had three panels in it. Much of that stuff is what I'm talking about, what's behind here. Much of those points are really what I'm talking about. So the issue is health information lacks specificity. The big problem is you are not engaged in the system. Going to the dentist when you think you need to, that's not engagement. Okay? And as a dentist, when you come to me with a problem, you've left me very few options because I can't control what you do. And what I do isn't, it doesn't make your tooth immune or your gums immune. Nope, you're going to go down if things don't change. So dental care, okay, why is dental care not a big component of primary health care? Cost, lack of evidence that it works, okay? Dentists know, they know there's something missing here, but unfortunately, they've been trained in a certain way, and it's hard to change your behavior if you've been working in a certain direction. It's hard to change. That's what everybody's doing. Next. This is my mantra. This entrepreneurship in my mind has come because, about the mid-'80s, I got away from the dentalese, and I started finding ways to hook my patients tribally. And I came up with this saying. And teeth are like trees and gums don't lie. And that is, those questions I'm going to ask you, they're going to tell me what I'm going to see. So therefore, you can't lie to me. You can't lie to me because this is quite simple. This is really the strategy of oral health business development. Just this. Next. So what I'm saying then, if I have you repeatedly provide data that reflects you or your care of someone, your 80-year-old mom with Alzheimer's, or your 2-year-old toddler, that information coupled with your diagnosis. I don't want to know what your dentist wants to do. Just tell me what you see, okay? Describe to me what's going on with the teeth and the gums. That's going to give me, the payer, the policymaker, the data to bring a transformation in health accountability. Accountability. Huge thing. Imagine if you could get a license, all you had to do, a driver's license, and all you had to do was show up with your birth certificate. You didn't have to take a driver's test. Didn't have to take an eye test. There'd be no stop signs, no traffic signals, no speed limits. Yeah, it'd be Armageddon. That's what we have in a healthcare system. That's why it doesn't work. Because you got three groups all thinking about it differently. Providers are billing for services, payers are trying to control costs, and consumers are hanging out doing what they want, and when they want care, then they want to give their insurance card, okay, to a health provider who's already $300,000 in debt and trying to operate a service business of healthcare when people don't come in when they're supposed to and don't do what they're supposed to do. Can't work. Impossible. Impossible. So what we need is data. Data. Very simple. Having those two pieces of data, okay, is going to make all the difference in the world. Now we're going to be able to provide health care for everybody. Yeah, everybody. Just last month, we admitted 3 children into the hospital for facial swellings. Their admission time was 3 to 5 days at a cost of $10,000 to $18,000. That was uncompensated to the hospital. That's what we're doing, because a predictable set of circumstances led parents not to know what they were doing, and then, of course, they showed up when it was a problem for them because their kid was in pain. They knew their kid had problems, but they couldn't get dental care, so they finally showed up when they had no choice. Next. So, this is what we're doing. This is what Ray is setting up. We're going to set up a program so that we can bring health care to people. But to take advantage of the health care, they got to give data. And what happens, they will learn individually. There's no way, okay, any primary care provider in the audience will tell you, and even you know, one big problem you have in your health care encounters is that your health care provider doesn't have the time to talk to you, because the system doesn't reimburse your health care provider on the coaching training. Okay? They got to support this service business. So the system doesn't even help the provider help you. Coach, mentoring, training, individualized, personalized medicine ain't happening. So why can't you do that sitting in the waiting room? The questions are well known. I didn't make them up. The question's been known for years. And there are movements in healthcare in this country to provide these kinds of technology. So essentially what we're going to do is bring the mountain to Muhammad. But Muhammad has got to be engaged actively. And I know what we're going to find. There's no question we're going to find. So next. And these are the outcomes. You have to, in order to have success, you have to create a system that everybody wins. Everybody wins. Nobody can be left out. We talk about business development, you talk about education, you talk about a lot of things. Well, if you're not healthy, I don't know how you're going to do it. And things happen at the worst time, in the worst situations. And all this stuff just happens because of data. This isn't rocket science. It's very logical, very simple. Next. Okay. So these are the key points. We want to have a patient, our healthcare system isn't patient-centered also. In fact, I look at our system as a slave master's mentality. Yeah. Yes, the information that you should have to guide you through your life, I should know. You should own it. It should be for you to gain it. Because if you're depending on me to give it to you in our present system, it's not working. Raise your hand if you tell me it is. Raise your hand, tell me. If you really understand what oral diseases are in your mouth, raise your hand. You should be able to. Most common prevalent set of chronic illnesses over the lifespan. Recurring all the time. Very simple. But if you don't know what they are, then you're really missing a point. It's your body. Okay? Next. This is really the system. In my view, what we have now is that we have health tools, but you've got to belong to somebody's community to have the health tool. There are things to read, that's right. There's a lot of stuff to read, but there's nothing that's really centered on you that you can take with you wherever you go. Because if you have a job in which Aetna is your health payer, and you leave that job and you go someplace else, but Cigna's your health payer, you lost your information. And my view is this information should be yours. It should be for you to build for your family, because this goes lifelong. It's not an event, it's a journey, it's an epic. And if you don't take control over it, the system is not built to respond to you unless you got lots of money. And I think the folks primarily we're talking about aren't in that position. And it's getting worse, and it will continue to get worse. The data are the areas behind the content behind the arrows, and the benefits to the different stakeholders are in green. And there, if there's countries in which there's a single payer, well, the payer and the policymakers, that's the same stakeholder. Next. Okay. So essentially, I have two things I want to say to you. One, I said already, teeth are like trees and gums don't lie. Okay? And the second is this. If I looked at your mouth, I'd have a pretty good idea about your other comorbidity list or your risk for it just by looking at your mouth. Thanks.
Thank you, Dr. Ferguson. I know we're getting a little tired, maybe very, so I'll be brief. I just want to share this information with you real quick. Dr. Ferguson talked about data, and the data is very, data means dollars, as you know. In our program with the Mignon Innes Ford Foundation, we do health education, we do community outreach, we do cultural orientation, we train physicians how to communicate and treat Africans. I have done extensive work in HIV care. A lot of the models and the templates, all that, when they talk about multicultural, Africans are not even in the picture. But that's because there's no data on us. That's because also we are not coming forth and providing the information. This morning, the panelists talked about advocacy, contacting your Congress people, making sure what your needs, having your needs known. We don't do that. It's not so much to be on African immigrants. That's not how we do things. Part of our mission and our cultural bridge building is empowering our African community to know how the system works. They have rights and responsibilities. We pay taxes, but we have to speak up. We have to be present at the community grassroots level as well as at the leadership and hold them accountable. So this data, we really in need of basic health statistics. We are in need of data showing what are issues that are important to the African community here. Also, advocacy. A lot of times I've attended a lot of community organization or citywide, etc. When I go there, the Asian, they have their people in a busload. The Latinos, they already know they can teach us. We are not there. We may fill out at one table. So we have to know that we are entitled, it is our right to be present and let the policymakers or the representative make sure that they are clear about what we need. Moving forward, I did pass around a sign-in sheet to kind of get an idea about, just from the top of your head, what are health priorities. If you have more ideas, you can also go ahead. We left the paperwork back there. We have literature on my foundation. We also have information on both our foundation in the booklet. We're very, very excited and look forward to having you back to do another session like this, but focusing in health, improvement of African community health, health enterprise that will link us globally. And for the last word, I'll give it to Ray. Thank you.
Thank you. In follow-up to Dr. Ferguson piece, how this is being done and implemented now. As I said earlier, this is a tri-state project. In our contact with the government officials, the CDC, they wanted to make sure that the African countries were involved, and they were already involved with this piece. But in particular, we are currently working on a project that involves, in particular, the largest population, current immigrant population in this region, and that's the Ethiopian population. According to data, there's over 300,000 in the tri-state region. So we're looking at this as an international project. It's being done in this region, reaching out into the African population. And we're looking at building the model here. Part of the model is data driven. The other model is treatment. So the dental mobile units are our partners. The universities and the hospitals are now becoming our partners in getting this project out on the road and into the community. So when Dr. Ferguson said the mountains and Muhammad, we are literally going out into the community using medical mobile units. And the consumer go through the survey model of the My Smile Guide U, and then head onto the dental van, which will provide treatment for them. There is going to be a similar project done in Africa. In particular, right now, as we speak, there is an organization called the Global Ethiopian Medical Enterprise Incorporation. It's a group of medical doctors all over the world who are now assembling in Ethiopia. There is a major state-of-the-art hospital being built there. The groundbreaking starts next week, and a lot of the medical doctors from all over the world are now assembling there in Ethiopia. This here in this tri-state region will become the model that will be taken over to the hospital there, along with medical mobile units that will reach out into the population. So I wanted to make sure that you understand that connection, that this is not only a local project, this is also an international and global, and making that global connection with the African immigrant population here and the African population on the continent. So with that, we will be coming together in the very near future, bringing on the stakeholders to discuss how to move this further, in particular in the African population.
Thank you so very much. This is just to give you a glimpse. Please keep in touch with those of you who have interest in the health issue. Talk to, at the networking sessions, talk to Ray and Miniap. And we're going to have a stakeholder meeting in July, just focusing on, we're going to help them. US Africa Diaspora Business Council is going to put the infrastructure and the mobilization of the community to help what they do, because health is very crucial and important here, as we live, as we make home, and back in Ethiopia. Please give a warm welcome. Thank you to Dr. Ferguson, who took his time, paid money to get here, all the way from New York. Thank you, Dr. Ferguson. Okay, this brings an end to our program. It was wonderful having you. Thank you so very much. And as we wrap, this is only the beginning of a big journey. I hope you've made connections. I hope you've been informed and you've been inspired. And this is the beginning. And please keep in touch. Make sure that you're in our network. And as I close this wonderful day, I would like to go back. It has been since January. This is what, 6-7 months. It has been fueled by passion. It has been organized by commitment and volunteerism. Nobody got paid. But I won't be excused if I don't mention our sponsors. On the front page, this book was possible because of the support that we got from Maryland Department of Economic and Business Development, the Montgomery County Department of Economic Development, and the City of Tacoma Park. The three have supported us. This venue was sponsored. We've gotten some help, but to the most part, it was fueled by community love. It was fueled by volunteers. And we're going to do more. We need you to join us. Read the magazine. Keep in touch. Thank you for taking your wonderful Saturday and being with us and giving us your spirit. More food in the room.